All right, let's dive right in. We're talking about week 32 of pregnancy, an absolutely pivotal time when so much is happening for you and for your baby. So let's get into it. So, here you are, 32 weeks in. You've officially hit the final 2 months of your pregnancy. You can see the finish line, but things are also kind of speeding up now. Your body's making its final checks, and your baby is getting ready for their grand entrance. Yeah, you heard that right. About 62 days left. The countdown is officially on. And believe me, every single day from here on out is just packed with some really crucial development. So what's actually going on in there? Okay, let's take a little peek inside your baby's world, shall we? Because right now, this is where all the action is, as they're putting the finishing touches on this incredible 9-month journey. I mean, just look at this. Your baby isn't just floating around in there. They're actually practicing. Their little facial muscles are getting stronger so they can make all sorts of expressions. Their hands are getting more coordinated, and their eyes are even opening for short periods. It's amazing. They're becoming a tiny person right before your eyes. And the progress this week is just wow. Your baby's packing on that essential fat and muscle, which is what turns their skin from that reddish color to a much healthier pink. And all those kicks, jabs, and wiggles you're feeling, that's not just for fun. That's your baby literally working out, strengthening their bones and muscles for the outside world. They're even settling into that classic curled up fetal position. And then there's that sound. You know the one. That incredible, rapid heartbeat. The normal range is usually somewhere between 120 and 160 beats per minute, which is way faster than ours. For so many parents, hearing that sound is just the most reassuring moment. You know, this gets a lot of people thinking about all the things we can do for our baby's development, which brings up a classic question. What about the baby Mozart effect? Is it actually true? Can you really boost your baby's IQ by playing them classical music? So, what's the verdict? Well, the truth is, not really. That whole theory has been pretty much debunked. But, and this is a big but, it does have a real proven benefit. The magic isn't in the music itself, it's what it does for you. Listening to music you love helps you relax. And when you're calm and happy, that is absolutely fantastic for your baby. All right, enough about the baby for a second. Let's talk about you. Your body is going through its own marathon, and the third trimester has, well, it has its own unique set of quirks. Let's get into what you might be experiencing. And let's start with a funny one. Something you've probably looked down and noticed lately, your belly button. Has your lifelong innie suddenly decided to pop out and say hello to the world as an outie? If this is you, please don't worry. It's totally 100% normal. It's just caused by the pressure from your growing uterus. Think of it as a little temporary badge of honor. It'll go right back to normal a few months after delivery. Okay, something that can feel a little more unsettling is heart palpitations, that fluttery, fast-beating feeling in your chest. It can definitely be alarming, but it's usually just a harmless side effect of all the extra blood you're pumping around. Now, the one caveat is, if it ever comes with chest pain or you feel breathless, that's your cue to give your doctor a call right away. And then there's the infamous pregnancy brain. Is it a real thing? Oh, yeah. If you feel like you're walking around in a bit of a fog, especially at work, you are definitely not alone. The best way to fight it is with simple routines. Take short, regular breaks, drink lots of water, and honestly, a notebook is your best friend. Write everything down. And above all, try to get enough sleep. It makes a world of difference. Okay, this next section is a big one. It's time to play a little game of myth versus fact. Because, let's be honest, everyone has an opinion when you're pregnant, right? We're going to clear a few things up. So let's just get right to it with a question a lot of people think about, but maybe don't always ask out loud. It's a really common worry. Can having an orgasm actually trigger premature labor? And here's the straightforward, reassuring answer. For a healthy, problem-free pregnancy, no, it's perfectly safe. You might notice some of those Braxton Hicks contractions afterward, but those are just practice contractions. They aren't the real deal. Now, if you're past your due date and trying to get things going, that's a whole different story. Okay, shifting gears a bit, let's talk about the main events, labor. You might have heard the term active birth floating around. What in the world does that even mean? Basically, it's all about ditching the idea that you have to lie flat on your back. An active birth means you use movement and gravity as your allies. You stay mobile, you walk around, you squat, you kneel, you work with your body. This can help open up your pelvis, and it might even make labor feel a little easier.
Things like a birth ball or a walking epidural can really help you stay in the game.
All right, we're rounding the final turn. Let's talk about preparing for the big day. And I don't just mean packing your hospital bag, I mean getting ready emotionally for this huge life change. And this one's for the partners out there, because your role is so important. But there's a delicate balance, isn't there? It's the difference between being supportive and being overly protective. The best advice? Let the pregnant person take the lead. Offer help, be there, but don't try to solve everything. Sometimes just listening is the most helpful thing you can do. Okay, now it's time for a little bit of real talk. Let's pull back the curtain on those first few days after the baby arrives, because it's not always the picture-perfect scene you see in movies. Here are a few things people don't always mention. First off, it's totally normal to get the shakes or even feel sick right after delivery. Breastfeeding? It's a learned skill for both you and the baby, so be patient. Those after pains can be surprisingly intense. But maybe the most important thing is this: that instant rush of overwhelming love doesn't happen for everyone right away. Bonding is a process, and it's perfectly okay if it takes a little time. Whew, it's a lot, isn't it? But you've come so far on this wild ride. For 9 months, your body has been doing something truly miraculous. And while that part of the journey is almost over, a brand new, even more amazing one is just about to start. Look, this final stretch is tough, no doubt about it, but it's also buzzing with this incredible energy and excitement. You've got this. So the only question left to ask is, are you ready for what's next?